Hi, I'm Dr. Jay Kovar with the Harris County ESD 11 EMS. This week's question comes from Molly at Ally Health in Spring. Take it away, Molly.
Hi, I'm Molly from Ally Spring, ER. Dr. K, what kind of burns do we consider an emergency?
So there's about almost 500,000 reported burns a year. The majority of those happen in the household. About 20% of those involved are children, and 65% of those burns are serious enough to where they're going to need medical help. The most common place for burns is in the home, either from house fires or right here in the kitchen. A lot of hot stuff here, a lot of really potential injuries. Obviously, water boils at about 212 degrees Fahrenheit. We make coffee at about 200 degrees, and we drink it at about 120 to 140. There's a lot of burns associated with coffee. Burns involve damage to the skin. Skin damage starts at 107 degrees Fahrenheit. We perceive pain at about 117. What's happened significantly over the last several years are safety devices such as a limit to the water heater temperature in your home. Nowadays, current regulations require that the temperature of the water heater be set no higher than 120 degrees Fahrenheit. At 140 degrees, it takes only seconds to cause significant burns. When the skin is burned, it depends upon obviously the temperature and the time of contact. The most minor burns cause pain and redness. This is called a first degree burn. When the damage to the skin is deeper, it causes blebs, causes blistering, etc. We call this a second degree burn. Both of these are still partial thickness because they haven't gotten into the deep skin structures. The structures that cause the skin to regenerate, the hair follicles and the pores and the sweat glands, etc., are damaged with deeper burns. We call these full thickness burns because they're into the subdermal tissue, and again, they destroy the ability for the skin to grow back. Anything bigger than about a quarter generally is not going to heal or grow back well without a skin graft.
So there's a lot of things in our environment that we come in contact with that we may not realize how hot they are. Simple things such as car exhaust, motorcycle exhaust, anywhere from 300 degrees Fahrenheit to over 1,000 degrees Fahrenheit. It takes literally half second to come in contact with something that hot to cause significant skin damage and bad burns. So a lot of us who are enthusiasts do a lot of things that look really nice, but we know the dangers of the burns. Other people that come in contact with them, that are around them, particularly kids, they're curious, they're anxious to get on and play again, and they're terribly unaware of how bad they can be burned.
What do you do if you experience pain, discomfort, etc. from a burn? The initial findings are going to be localized pain, redness, and swelling. Over a time period, and the burns may take several hours to evolve, you may get blistering under the skin. If that blistering gets infected, if that skin damage gets deeper, you can actually damage those structures and prevent the skin from growing back. So what should you do if you experience a burn? Obviously the burn hurts and it's going to swell. Remove any restricted clothing, remove any clothing that still has a chemical or any liquid on it, because that's going to continue to burn. The second thing to do is to run the burn under cool water, not ice water, not applying ice directly to the burn, but basically trying to cool the skin temperature surface as quickly as possible. After that, you'll want to protect the skin. You can protect the skin with a sterile ointment, Neosporin, bacitracin, etc., or you can even wrap saran wrap around the skin, etc., to prevent pain, discomfort. Even the air current is going to cause some irritation and damage. You've probably heard a lot of myths or stories from your grandmother. Sorry, Grandma, but putting butter on the burn is a really, really bad idea. Number one, it has salt in it and it really hurts. Number two, what you want to do is you want something that's not greasy, not oily, etc., that is going to protect the burn and not cause any further damage. Aloe vera, which is found out in the yard, is a really good thing to keep in your refrigerator for treating burns. It works very, very well and highly recommended. So how do I know when I need to seek medical attention for a burn? Obviously, burns are very, very painful, and you may need to seek medical attention just for pain control. But burns that immediately blister, burns that look blanched, that look deeper than just blistering are very, very serious. Burns that involve the hands, burns that involve the flexor surfaces, the creases, burns that are on the face and can cause cosmetic problems, burns in the groin, burns in the perineum, burns around the genitals are very, very dangerous for infection, scarring, and loss of function. So what can you expect from EMS? Well, EMS is going to respond immediately to your needs and check you out. Again, a lot of the burns occur in the house, and we can start to address your burn, manage your pain, and determine where is the most appropriate care for you. Do you need a local hospital emergency department? Or are you going to need something more advanced like a burn center? And one of the burns we need to talk about is sunburn. Sunburn doesn't come from direct heat from the sun, fortunately. It comes from ultraviolet radiation. Now, the sun releases ultraviolet A, ultraviolet B, and ultraviolet C. Ultraviolet C is screened out by the ozone layer. Fortunately, we shouldn't get much of that. But ultraviolet A and B do reach the skin. Ultraviolet B goes and is absorbed in the upper part of the skin and is responsible for the tanning and the burning. Ultraviolet A penetrates deep to the upper layers of the skin and is responsible for wrinkling, aging, etc. Not only should you protect your skin from the sun, you should protect your eyes. Sun damage, the same UV ultraviolet rays are going to cause glaucoma, retinal damage, macular degeneration, and in some rare forms, cancer. Sun damage to the skin, UVB rays, are what is a main source for skin cancers, melanomas. Now, you may have heard the term sunstroke. Well, sunstroke is being out in the sun, being overheated. It combines heat stroke, where your body's core temperature goes up above 104, altered mental status, changes in your mentation, nausea, vomiting, severe headaches, with the dehydration and the sunburn. That's called sunstroke, but it's really severe sunburn, sun exposure with heat stroke. So the keys to avoiding sunstroke, number one, is to keep yourself very, very well hydrated, to stay out of the direct sun, to try to avoid some of the damaging rays from the sun, and recognize the symptoms. Again, headaches, nausea, not feeling well, feeling a little dizzy, not quite right, a little altered, your day is over, you really need to stop what you're doing, get somewhere, cool off, take care of your skin. So if you have a question you'd like us to address on Hey Dr. K, reach out and we'd be glad to talk to you. Take care of yourself, we're here for you.